My name is Hugh with HFHill & Associates, and today I'm going to go over a used Galaxy stationary McManis table. Okay, so if we're going to start with the headpiece has the classic Lloyd options where you have varying width here, and in its widest position you can lift up the paper guide bar and get that nice and clean for any of your patients and put it back down. Okay. The table headpiece tilts all the way up and all the way down, and this little black knob here gets it to go straight, and this knob on the side gives you your elevation. So it's got an elevating head if you're going to put somebody on their side and work on that. So you have an elevating head as well. Moving south on the table, you have a chest section that goes down and it stops wherever you stop it, and it also has a spring to it. So it's got an adjustable chest and a spring chest built into it. All right, there's no drops on this table. Right here, this little knob right here, you pull it out and the whole table gets longer. Okay, does that for two reasons. One, it gets longer and shorter for taller and shorter people. And clearly there's a space right here when we make it get longer, and this is an extension that slides right in here, and that'll help fill that gap if you're going to put somebody really tall on it. If not, it's going to slide right back here, and this is a position that most people use it. Okay, so our pelvic section does a number of things. Down here you have a needle valve. It's an open and close, spin open and close valve. It allows you to stop putting pressure into the flexion cylinder. There's no motor on this table. It is not an elevation table. It's a stationary. Therefore, there's no motor on it. So you're the motor, right? So if we want to increase pressure in our flexion cylinder, right here, if we put a heavy patient on it, you simply pump. Right here, that's what this hand pump, foot pump is doing, and it's adding pressure into your flexion cylinder. And the pelvic section extends and retracts. So again, you're the motor, so we push in to bring it in, and we pull out to send it out. So here it's in the out position, and if you notice right here, every time I give it a foot pump, it goes out further, okay? And the opposite is true. If we push it all the way in, we foot pump it in. And it has to remain in the center position. It's a 3-position Versa valve. Has to remain in the center position to do your flexion distraction. Okay? And this black knob right here allows you to do lateral flexion. Right? And when you're doing that, of course, you can do circumduction as well. So you can do all of that. You can lock that back in. Let's get our table straight right there. Lock it back in and lock your pelvic section as well. So moving back here, you have a slide out ankle, and a slide up ankle. And lift it, move it whatever position you want. So it's a slide out and slide up. You can snug it in right there, and you got a T-bar that is a breakaway T-bar for your manual flexion table. So that's it. It's actually in really good condition. The naugahyde is in, we'll replace it if it doesn't look good or doesn't feel good. The foam is not broken down. It's in very good condition from that perspective. Thank you very much.